Eastern Shore Mobile Crisis is a free behavioral health crisis response program. We serve 8 counties on the Eastern Shore. We serve from Cecil down to Somerset, and our teams are available from 9 a.m. to midnight to go out into the community to work with people who might be experiencing a myriad of different crises. We define crisis as the person who calls us defines crisis. They can reach us by calling 888-407-8018. That's the Eastern Shore Operations Center. They're a separate program from us, but we work vitally hand in glove to provide this service here on the Eastern Shore. And again, it's a free service that it is available to the citizens of the shore. And that phone number, 888-407-8018, is available 24 hours a day. So if someone is experiencing a crisis at 2 in the morning or at 7 in the morning or at 7 in the evening, that phone number is staffed by qualified, trained clinicians and other individuals to provide the best service that they can over the phone. They'll ask folks a series of questions to triage what might that person be experiencing, and from there they'll determine, does the mobile crisis team need to get sent out? And our mobile crisis team, we go to the person in crisis. If that person is at their home on High Street in Chestertown, we'll go to that home at High Street in Chestertown. If it is a school in Rising Sun in Cecil County, we will go to that school where that individual is in crisis. We also work with individuals who are homeless, who find themselves in crisis. And we've gone to many of the homeless encampments. We've gone to parks in our local communities to work with folks who are homeless, who might be experiencing a mental health or an addictions crisis at that moment. Anyone is able to call and make a referral. It could be the person that's experiencing the crisis directly. It could be a concerned family member who is not sure where to turn for their loved one. Or it could be, again, a school. It could be a therapist in the community, an outpatient addictions provider in the community who has been serving someone, seeing them during a therapeutic session, and during that session some things came up and that clinician was just a little bit uncomfortable about that person going home and remaining safe in the community. So that clinician might call the mobile crisis program and say, hey, I saw Sally Sue today in treatment. Could you guys go out and just check on her tonight, because it's Friday and we want to make sure that she stays safe over the weekend? That's also how it can work. Our goal is to try to keep people safe in the community and try to, if at all possible, keep them out of the hospital. One of the things that we've been doing over the past several years through some additional grant funding that we've received is we've been working and doing training for our first responder partners so that they can better identify and more empathically work with the neighbors that they serve each and every day. And that's made a significant difference in our communities as well. We're just really blessed to work with our neighbors when they're at their most fragile. And I just am so grateful for this opportunity to share with the many folks who follow the Easton and Chestertown SPY. And so thank you so much. Absolutely. Affiliated Sante Group is our parent company based in Silver Spring, Maryland. And it started in the early 70s as the Rock Creek Foundation, serving individuals with developmental disabilities. And it was one of the first, if not the first in the country, to coin the term dual diagnosis. And for individuals with developmental disabilities and mental health diagnoses, treating it as one individual with co-occurring issues. And so from there, affiliated Santé group started to have outpatient mental health clinics, and then in the mid to late 90s was one of the first mobile crisis providers in the state of Maryland, starting in Prince George's County. And today, in 2014, affiliated Santé Group is Maryland's largest provider of crisis services, behavioral health crisis services, that is. And it was the pioneering spirit of Fred Chanteau, our CEO, who has moved us forward from the early 70s up through 2014 in all of these pioneering efforts. Back in 2009, many of your followers, I'm sure, recall that there was the plan to close the Upper Shore Community Mental Health Center, the state hospital based here in Chestertown, where we happen to be doing the interview today. And so as part of the community outcry and community advocacy, the governor and the head of the Mental Hygiene Administration and Department of Health and Mental Hygiene realized that this was a community that was very passionate about its neighbors who have mental health and addictions concerns. And so as a result of that advocacy, while the hospital continued in its movement to be closed, the governor reallocated about $1.3 million back on the shore in the Midshore region to provide additional community-based mental health services. And that really was through the leadership of Midshore Mental Health Systems, the local mental health authority for our 5-county region. I feel incredibly blessed to have this job. I feel incredibly blessed to work with our neighbors when they're at their most fragile. Because when somebody's experiencing a crisis, the opportunities that they have to empathically work through that crisis can mean the difference for their path to recovery and their path to ongoing resiliency.